Hello, hi, welcome to my channel. So basically today I'm going to do Q&A session, answering all the questions. I've put some questions on my Instagram and YouTube video asking whether you have some questions, and I'm going to answer them today. First question is, can we join GP training after MRCP? Yes, definitely. That's what I did. Having another qualification doesn't exempt you from joining another training program. Can we do MRCGP and MRCP together? Yes, definitely. There's no reason why you can't, but just bear in mind that both exams are quite difficult. MRCGP is difficult in its own way, MRCP is difficult in its own way, and in MRCP there's 3 parts and MRCGP there's 2 parts, and basically each part require a few months of preparation. So I would think better to focus on one exam at a time so that it gives you higher chance of success. And normally MRCGP is kind of a requirement to complete the GP training, and MRCP is a requirement to complete core medical training. Can specialists work as a private practitioner and NHS consultant together? Yes, consultant can work in private and NHS together. In fact, most of the consultants I know do that. They work in their NHS job and they also have their own private practice. And sometimes patients who are not keen on the NHS long waiting list, they kind of paid to go to be seen by private so that they don't have to wait for a long time, and then after that they kind of ask to be referred back to NHS to have their treatment or investigation. Yes, so basically the normal amount of annual leave in the UK is about 27 days in GP and 28 days in the hospital setting, and after 5 years of NHS service then you get an additional 5 days of annual leave, so it becomes 32/33 depending on where you work. You can take all the leaves, but normally they don't allow you to take leave all at once. You also get 28 days of study leave as well. After PLAB, it is not necessary to have MRCP to get a job. As long as you pass the PLAB and registered with the GMC, then you can apply for NHS jobs. So to enter specialty training such as cardiology after clearing PLAB, normally I would advise to, after finishing PLAB, get a job in the NHS as a trust grade, just to get an experience working in the NHS, and then while you're in there then you can apply for specialty training. I've seen a lot of people do that. Normally I guess the competition would be the same. I've seen a lot of IMGs get into specialty training after working for 1-2 years being a trust grade, and then they decided to apply for specialty training straight away. I think it hasn't affected much because I am non-EEA country. I guess the Brexit affects more of the EEA countries, because non-EEA anyway have to apply for visa anyway to come to the UK, so that hasn't changed much. The only thing that has changed since COVID is they have scrapped the IHS, which is quite expensive. During med school, I use quite a lot of books. Normally I borrow them from the library. Actually it differs from year to year, so year 1 I use a different, year 2, so up to year 5 is all different books. But if you would like me to make more videos about the books used during my medical school, then just give a comment below and I will do a more detailed list of the books. So night shifts, basically as a GP trainee in Wales, we are contracted to do out of hours. I have just recorded GP out of hours night shift with me, which will be coming out next week, so I will link up here once I've done it. We do have to do out of hours shift, but we can book the shifts. So basically if you don't want to do night shifts, then don't book night shifts. So basically it's any time out of hours. So the normal GP hours is 8 to 6:30, so outside of these hours will be counted as GP out of hours. So yes, Welsh trainees are contracted to do them and we are paid slightly higher to do them. This applies the same for Scottish trainees as well, but not for England. I think they don't pay for England. I think England has moved from allocating specific hours of out of hours, but correct me if I'm wrong. So it depends on interview. In my experience, interview depends on what kind of job you want to do. So interview for core medical trainee is different for interview for GP trainee, and different for interview for hospital job, NHS job. So what I'll do is I'll give a general advice and tips for just an interview for the hospital job, but I will make more videos about interview for the GP selection center. So for NHS jobs, normally you will have to do interview. I think normally it will be 2 consultants asking. I guess it depends on the hospital, but I know in my hospital where I was working, 2 consultants are the interviewer. They probably ask like just general questions about experience, and then they ask how you would manage an acute scenario. So my advice would be familiarize with common medical scenarios like DKA. That's one of the questions being asked. I guess PE, ACS, all the likely conditions that, I mean, depending on the job that you're going to. If you like in medical, those are the questions, but I guess if you're going into like ONG jobs, then common ONG conditions and orthopedics, common orthopedics conditions, familiarize the common conditions which tend to be in that department, and hopefully when they ask the questions, then you can ask. I mean, the general principle is the same. It will be like A, B, C, D, E, history, examination, and then I guess the management will depend on the stabilizing the patient, just blood, x-ray, depending on the presentation. Thank you very much for submitting the question. I had fun doing the questions, so hopefully I can do more of these sessions again. And if you have any question, then please drop in the comment below, and I'll be happy to answer in my next Q&A. See you then. Bye.